I would say the unfortunate part with us is that if you mess up with the patient, that patient ends here. There's nowhere else the patient goes. So you have to be very careful, very cautious with what you are doing with the patient, how you are doing it, because that is the final thing that is being done.
Kamuzu Central Hospital forms one of the 4 main referral hospitals in Malawi, serving the central region. As a referral hospital, it receives complicated cases from all the 9 districts in the region. It also receives referrals from all health centers that serve the population within the district of Lilongwe. KCH offers comprehensive care in all departments, from outpatient departments, radiology, laboratory, and inpatients, including serving women in labor and delivery. In the labor ward, most cases handled by KCH are difficult cases referred in from different health centers around Lilongwe and beyond.
My name is Amon Dembo. I'm a nurse midwife. In here, I'm a nurse midwife practitioner. Let's say a direct care provider, but I am also a nurse midwife in charge. Now that's a managerial aspect of nursing side.
Amon Dembo graduated from Kamuzu College of Nursing in 2016 as a general nurse midwife. He started working in Maternal Mortality Maternity Wing Labor Ward since 2019 as a nurse midwife in charge, who also serves as a direct midwife.
In here, there are a number of things that we do as nurse midwife providers. The first thing is what everybody knows, that's conducting deliveries. But then taking care of a pregnant mother in labor, it's not just a matter of saying conducting the delivery. It involves both taking care of the psychological part of the mother, the physical parts, whereby now that's the direct care comes in, and then other issues that comes with the patient, including their families.
Before delivering babies, Amon creates a relationship with the woman in labor and simultaneously triages the women in 3 categories: emergency, urgent, and non-priority, while determining the agency in which he needs to handle his patients. This is called triage, a process of sorting a patient into emergency, priority, and non-priority. Amon then assesses the patient's vital signs, assess both the mother and the baby's well-being, and inform the doctor to review the woman as he proceeds with care.
Then we ask you why you are here. When you tell us your problems, then we gauge from there. Are you an emergency patient, or you can wait a little bit?
As a referral hospital receiving cases from different hospitals, doctors review the patients, form part of the initial assessment in labor.
Depending on whether you are an emergency or you can be seen later, and then the midwife will check your vital signs, your BP, your pulse rate, your temperature, those things, and then you proceed to do other assessments on you. Talking of if you're in labor, how far is your labor, things like those, and then that's the entire admission process. So in here, a midwife will admit you. Once you are admitted by a midwife, a doctor will come again and see you. That's our protocol here. Seen by a midwife, a doctor comes in.
Even though labor ward is a very difficult place to work in, what motivates Amon to stay in labor ward for so many years?
Seeing a mother getting out here with a live baby, that makes me very happy. More especially when all hope seem to have gone away, and then we do what we do here, and then they have their live baby, they go home. That's very satisfying. That's what's keeping me here.
Amon thrives on the satisfaction he gets when he sees patients recovering and smiling after he has taken care of them.
You know, we have patients that are very sick. They come in, We manage them, they get better, they go home. You know that feeling when they tell us, thank you very much, we didn't think we were going to make it alive. I love babies. Okay. So we get the satisfaction with our clients. They prefer majority of us males as compared to their female counterparts. It's more common here. So the fact that we have clients that are satisfied with our care, how we do our things, that's positive enough. Of course, there's still some setbacks, as you have said, a female-dominated profession. Yes, but then every profession has its own ups and downs. As we see them, we just accept that it's a profession. Those are things that are bound to happen. So, in as far as they don't actually negatively affect patient care, then they're sorted. But we get much of our satisfaction from the outcome that comes from our patient, because we're here for them. Most of our patients here are labor patients. So how we perceive labor, because I think they perceive that we understand what they are going through. Most of the times you rarely see male midwives maybe shouting at the patient. There are some, not here of course. Maybe in other cases there are some that do shout to them, but we don't. So that alone, because labor is painful. It's a stressing experience. The person is already stressed with the entire process, and then you behave in a way that you are like belittling or making them feel like the experience is not that much, because you have gone through it. That maybe with the female counterparts somehow does compromise care. To us, we just, okay, if she's saying she's in pain. See? So that makes them prefer males than females. We don't know how labor feels. Their friends know how labor feels. When you say a woman is in latent labor, their female counterparts understand how latent labor feels. For us, we don't know how that feels. We just say, okay, she's experiencing at this moment this type of pain, this is what we should do. So. The most challenging part with being a male in an environment like this, what I've seen so far is that the patient themselves, in some instances, they would want to manipulate you into doing what they want, of which in most of cases it's not supposed to be like that. We have to do our job as the standard says. But the moment you try to manipulate us into doing what you want to happen to you, which is contrary to what is supposed to happen, then that compromises care. So there are usually issues that do arise sometimes, yeah. You have to be a person who has a strong sense of self-control, because we are human beings. Women do come, some have their own issues, you see. They would want to associate with you in that way for their own benefit. So you have to make sure that you stick to the professional standards. You don't get carried away with what is happening or what your client might want the relationship to bring. Now for the general our environment, this is a government-funded hospital. The problems are supposed to bound to happen. We somehow have challenges with resources, but good enough our management tries their best to make sure that we have the resources available. When we are lacking, they work so tirelessly to make sure that whatever the basics should be there.
Malawian nurse midwives have received criticism over the quality of care and their attitude. Midwives have been accused of negligence, patient abuse, and malpractice. How do AMON handle such issues?
I have to make sure that if there are issues that are involving patient care, those issues are sorted. And also the team that is available. It's also my responsibility to make sure that the care they are rendering to the patient is the care that is according to standards. If you complain, if a patient complains that maybe a certain midwife did not treat them well or did not speak to them well, if they complain, they know there are some others who knows that there's a chain of command who to report to. But when those people come, it means I have to talk to my midwife separately and the patient separately to get a balanced version of the story, okay, and then see how best we can help each other. Because sometimes the alleged negligence is classified as negligence because of something that maybe was done, but the patient wasn't told. Or was supposed to be done, but was not communicated to the patient. But in some other cases where the aggrieved feels the way we have solved the problem is not satisfactory to them, we have hospital ombudsman. So usually I do refer them to the hospital ombudsman who takes up the issue, and then there is further discussion, dialogue on the issue until the issue is solved. Some do, when they are not still impressed, satisfied, they do report their issues to the Nurses Council. The Nurses Council come and do their own investigation, see what went wrong, what should have happened, what happened, and then we reach a consensus on what the issue should be like. The moment you are told, now you're going to Kamuzu Central, it brings fear. The impression is always that it means it's gotten worse for you. If they're referring to Kamuzu Central Hospital, people are always usually afraid. As for our rebound here, what we want to achieve, what we are striving to still meet, is that this rebound should be a safe haven for our mothers. Okay, I told you that the women we have here are women that are usually in distress or worried with a lot of things. The most person who is available on the ground is the midwife. So if you're not taking if you're not taking care very well by the first person you meet, then everything goes haywire. So we're striving to make sure that, in as far as midwifery is concerned, when you come here, when our mothers come here, when they meet our midwives here, they should feel welcomed. And they should feel welcomed. they should feel free to air out their issues, their problems, and get the best quality care they can get, quality tertiary care they can get, because what we do here is tertiary care. So the tertiary care that midwives are giving here should not just be tertiary care, but tertiary care of good quality. That's what we are striving to achieve.
Despite fears and anxiety that people have when they have been referred to KCH Labour Ward and other departments, nurses like Amon and his team are working hard to provide quality care and save lives. There is hope that when you have been referred to KCH, you will receive the best care possible.